In this video, we are going to look at another urinary tract problem, which is frequent urination and what really causes it. You may have drunk coffee, alcohol, or large amounts of water, which increases blood volume flowing through the kidneys. In contrast, increase in the number of times you pass urine may be a warning of a possible infection, and you should ask your doctor about that. Frequent urination at night. Research shows people who are between the age of 40 to 50 may wake up once at night to go and pass urine. Between the age of 60 and 70, they may wake up twice at night. And above the age of 80s, they may wake up like 2 or 3 times. But waking up too often in the night can be a sign of a health condition. Frequent urination can be caused by many factors. But when we narrow down to the urinary tract, one, it could be as a result of urinary tract, bladder, and pelvic conditions. And this is too wide. We are going to see what are these urinary tract, bladder, and pelvic conditions. Another one could be as a result of an enlarged prostate. But many other factors can cause frequent urination, like pregnancy, diabetes, conditions that affect your brain or the nervous system, like stroke or the spinal injuries, medications like diuretics that remove salt and water from the body, heart failure, and also it can be a sign of fibrates. We have mentioned of the urinary tract, bladder, and pelvic conditions. The urinary tract infections are most common causes of frequent urination. And these are bacterial infections in your bladder, urethra, all other parts of your urinary tract. And this is what we call cystitis or bladder infections. We have what we call urethritis, which is the infections of the urethra. And also we have what we call pyelonephritis, which is the infection of the kidney. Different types of vaginitis, which is the inflammation of the vagina, which causes frequent urination, resulting in discharge, itching, and pain. We have different types of vaginitis. One is what we call bacterial vaginosis, which is the overgrowth of bacteria naturally found in the vagina, which brings the imbalance of the natural flora. We have yeast infection. It's caused by a naturally occurring fungus, which we call Candida albicans. We have trichomoniasis, which is caused by a parasite and is often sexually transmitted. So under vaginitis, we have mentioned of bacterial vaginosis. In other words, we call it PV. We have yeast infection and trichomoniasis. Other urinary tract, bladder, and pelvic conditions is what we call interstitial cystitis or bladder pain syndrome. This is when the walls of your bladder become irritated and inflamed, causing bladder pressure and pain. This causes frequent urination, often in small amounts, throughout the day and at night. Another condition is what we call overactive bladder syndrome, abbreviated as OAB. This is when you feel a sudden urge to urinate and you can't hold it. And it brings what we call of loss of urine that is not intended. In other words, it's what we call urgency incontinency. Another condition is what we call uterine prolapse, or what we call urethra bladder. This is a condition where the uterus slips down into or protrudes out of the vagina due to the pelvic floor muscles and the ligaments stretching, weakening until they no longer provide enough support to the uterus. And it mostly affects women past menopausal stage and who have had one or more vaginal deliveries in their lifetime. We have another condition by the name urethral strictures. The urethra narrows due to the scarring causing problems by narrowing the tubes that carries urine out of the body, making less urine to come out of the bladder. Hence, passing urine more oftenly or feeling the need to pass urine more often. We have what we call radiation therapy. Pelvic tumor or what we call bladder cancer can cause this frequent urination. Another thing we mentioned which causes frequent urination when it comes to the urinary tract problem is what we call an enlarged prostate. This mostly affects men when they approach old age. If you look at the anatomy of the urinary tract system, especially for men, the prostate is a golf ball sized gland which makes some liquid that comes out during ejaculation. Now, an enlarged prostate, what we call penile prostate hyperplasia, PPH, or more rarely what we call prostate tumors, can place pressure on your urinary system and cause frequent urination. I believe you have gotten what really causes frequent urination when it comes to the urinary tract problems. The good news is that this condition of frequent urination can be managed through treatment. When you go to the healthcare provider, you explain the problem you have. Your healthcare provider will be able to take urine sample to test whether you have what we call urinary tract infections. If they don't find other causes, they may use an ultrasound or a CT scan to look whether you have tumors or other structural issues. At the end of it all, you'll get the best treatment. How can you stop this frequent urination? So treatment will depend on the underlying cause. Limit the amount of water you take or alcohol and coffee, especially some few hours to bedtime. Another way to stop this is to do what you call treatment of the urinary tract infections, especially the lower urinary tract infections, which is cystitis and urethritis. Through antibiotics, you manage the prostate issues, which is the enlargement of the prostate. Another thing to do is what we call pelvic floor physical therapy for overactive bladder. And then you have what we call Kegel exercises. If you have uterine leakage, along with frequent need to go and urinate. Another thing to do, especially at home, you can wear what we call protective pad to avoid leaks, especially to deal with the short term as you treat the major condition. Thank you so much for always coming back to check on this channel. If this video resonates with you, kindly don't hesitate to share the link. By sharing the link means you're considerate, and if you have just come across this channel for the first time, kindly consider to subscribe. For the returning subscribers, I always say thank you for always coming back to check on this channel. Thank you so much. Bye bye.